Good afternoon, everyone. Thank you for joining us today. We will get started with our webinar training in just a few minutes. Good afternoon, everyone. Thank you for joining us today. We will get started with our webinar right at 3 o'clock. Thank you for being with us. Good afternoon, and thank you for joining us today. We will get started with our webinar at exactly 3 o'clock. Good afternoon, everyone. Thank you for joining us. We will get started with our webinar in just 3 minutes. Thank you for being with us today. Good afternoon, everyone. Thank you for being with us today. We will get started with our webinar in 2 minutes. Good afternoon, everyone. We'll get started in just about 1 minute. We're so glad you're with us today. Good afternoon, everyone. My name is James Harris, and I am speaking to you today from the Center for Faith and Opportunity Initiatives, or for short, the Partnership Center, as we're known at the U.S. Department of Health and Human Services. Before I do some opening remarks and we get started with our webinar today, I just wanted to note that we have noticed that Zoom has had some technical issues today. So if for some reason that you get kicked out of the system, please just use the link that you joined with to rejoin, and we will continue right where we left off. So I am joined today by our very special guest and presenter, Dr. Teresa Wagner from the University of North Texas, who will be leading today's training titled Clinical Trials 101 for Community Health Workers and Other Frontline Health Communicators. And I will introduce her more fully in just a moment. There has been a lot of things in the news, but hopefully many of you have seen the good news announcing a potential vaccine from Pfizer and Moderna. Last week, Pfizer announced that their potential COVID-19 vaccine may be more than 90% effective in preventing COVID-19. And just yesterday, we received even more good news when Moderna announced that their potential vaccine may be 94.5% effective in protecting against COVID-19. And this is really hopeful news. So what does Pfizer and Moderna's success even mean? How did we get to where we are right now? What is the status of other vaccine trials? And what is the participation of representative populations in those clinical trials? In other words, will these new vaccines work for our great and diverse population? And most importantly, I want to highlight for our audience today, consisting of community health workers, promotoras, and faith community nurses, and other frontline health communicators. How do each of us, how do we learn how to best communicate the process for making vaccines? And how do we talk about these essential clinical trials with others in our community in ways that will actually inspire them to participate in what could be a life-saving opportunity? And that is exactly what our task is going to be today. So before we transition into our webinar, I have a few short housekeeping items I need to go over. This is an educational webinar. It is off the record and not intended for press purposes. If you are a member of the press, we will be happy to connect you with the HHS press office at the conclusion of this program. We have a very full and packed program today, and it will run for the full hour. But we welcome your questions throughout the presentation. If you will use the Q&A feature in the bottom of your Zoom screen, we will try to answer as many questions as possible in the time we have. Please note that this webinar is being recorded, and we will send a link to the recording following the webinar, as well as a certificate of attendance for all those who attended live today. And now I would like to introduce you to Dr. Teresa Wagner. Dr. Teresa Wagner is the Assistant Professor and Clinical Executive for Health Literacy at Safer Care, Texas for the University of North Texas Health Science Center, where she holds a doctorate in public health. In her role at Safer Texas, which was founded as a response to the national challenge to improve patient safety, she has been a champion of health literacy. She not only develops and delivers programming for community health workers around issues contributing to health disparities, but her testimony on health literacy legislation in Texas actually helped to place health literacy into the state health plan. Dr. Wagner received the 2018 Texas Health Literacy Hero Award, as well as the 2020 Distinguished Alumni Award from Texas Christian University. She has received both the Media Award and the Distinguished Scientist Award from the Texas Academy of Nutrition and Dietetics. Dr. Wagner, we're so very glad that you're here with us today, and we are eager to hear you explain the exciting world of vaccine development and really learn how we can take this good news back into our communities and share it with others. Dr. Wagner, I am going to stop sharing my screen and I will turn it over to you.
Thank you, James. Well, welcome everyone. I am so honored to be here today to speak with you. And one order of business that I would like to start with is to let you know that throughout this training, I'm going to speak about community health workers. But that's because in Texas, where I'm from, we have a state certification for community health workers. So we tend to use a lot of them. We do have promotoras as well and faith health nurses, but that's the primary language I'm going to be using. So just know that I'm speaking to all of you. The Clinical Trials 101 that I developed was developed in collaboration with my colleague, Emily Spence, also from the University of North Texas Health Science Center School of Public Health, and Denise Hernandez, who's the president and founder of the Dallas-Fort Worth Community Health Worker Association. So important to be working with those community-based organizations as we move forward in this work together. I also wanted to let you know that I work in the Texas Center for Health Disparities, which is funded by the National Institute for Minority Health and Health Disparities. And our work on the SEAL project, which I'm going to be talking about today, was also in partnership with NIH and the National Heart, Lung, and Blood Institute. And the Texas Center for Health Disparities is run by Jambor Vishwanatha, and so let's get started. So as we know, as we've gone through all of the media that's been going on around COVID-19, that many racial and ethnic minority groups have been unequally affected. And we know that because of this, we've started looking at why is that they have been affected in this manner. And what we've boiled it down to is these social determinants of health. And for those of you who aren't familiar, although I have a feeling that many of you are, social determinants include things like housing, racism, food access, access to healthcare, education, all of these factors that play a role in not only your economic health, but also your physical and emotional health, and just how healthy and well you can be overall in your life. So what we do know is because of all these risk factors that limit our community's ability to be healthy and well, they also have had a higher risk towards COVID-19. So in Texas, because of our certification with community health workers, we have to spell out the objectives. So our learning objectives today are going to be that we stay current on health issues affecting our clients and know where to find answers to difficult questions. That's what I'm going to be sharing with you around COVID-19, and organize with others in the community to address health issues or other needs and concerns. And this is all part of the Texas SEAL initiative, which I'm going to be talking more about here in just a few minutes. So as I mentioned, COVID-19 has been impacting our communities. We've been most impacted. It's been these health inequities that have occurred that we need to address, and we need to talk about the solutions and the vaccine trials and the vaccines in ways that our communities can talk about or can understand. So that is why I'm speaking to you today. And what I've done is really taken information that's out there and simplified it. So there's going to be some links that I'm going to show you where you can go, and videos to get more information if you'd like. But today's training has been pretty simplified so that you can speak to your communities in a way that's helpful for them to really understand and embrace trying to help improve their health and their risk factors. So as we look at race and ethnicity, we see that our communities of color have been most affected. And so if you look at the rate ratios of cases, hospitalization, and death in surrounding COVID-19 against white non-Hispanic persons, American Indian and Alaskan Natives, and Black and African Americans have quite a bit higher risk, over 2 times. Asians have a little bit higher risk, and Hispanic and Latinos also have quite a high risk of getting more complications and having cases more so than white non-Hispanics. So how can we help as our community workers? What can we do? Well, what we need to do is to help bridge the education that our communities need so that they know why we might be recruiting them for vaccine clinical trials or research studies or other solutions to the COVID-19 pandemic, so that they can understand that it's important that they participate, not only to help protect themselves, but help protect their families, their communities, and everyone surrounding them. So since it's a new environment or a new virus, we have to look at every possible way that we could be able to combat it. So we're exploring new ways to improve comfort and quality of life for people who actually get COVID-19, which might include drugs, medical devices, or other therapies, improve methods to detect the illness and its risk factors, ranking 1 or more ways to diagnose COVID-19 because it's been so all over the map and it affects different people in different ways. Discovering 1 or more treatments for the virus, so how to prevent, how to treat symptoms, and the condition itself. So as I mentioned, this will include vaccine trials, vaccines, and might even, as we all know, and we've been trying to follow, and it's, you know, possibly been impacting all of our lives quite significantly, but behavioral changes such as masking, hand washing, and social distancing. So I wanted to answer some of the most pertinent questions that your community may be asking, because I know these are the questions that I've been hearing. Why do we need a vaccine if we can take these other actions to prevent it from spreading? Well, we need to use every tool available to us. Vaccines can boost our immune system. If we're exposed, it helps us to fight it off. And other steps can help reduce the spread. However, in order to contain it all together, we need to make sure we have these vaccines available. And we'll talk more about why that is when we talk about antibodies and herd immunity in just a few minutes. So why are clinical trials trying to enroll people of color? Well, so far we've not had good diversity in clinical trials. And what we know is that when all communities don't participate in clinical trials, then we don't know if they are safe and effective for every community, because what works for one genetic group of people might not work for another genetic group of people. So it's very important that we do have diversity in these trials. What if clinical trials don't enroll enough people from a diverse population? Well, then the vaccines that are developed may not be safe and they may not be effective for all groups. So it's very important. We don't want to be giving a vaccine to someone thinking that it's going to have one effect and it has another. Some people from diverse groups don't trust research. So how are we going to build trust? Well, what we need to be doing right now is being very transparent. And we know that you, as workers out in the community, are a valuable source of trusted health information. So we want to get that information to you so that you can share it with your communities. And we want to build trust. So I know here in Texas, I've been working out in the community for a long time, so it's really not anything new for me, and it's probably not anything new for you, but we want to let all of our communities, our diverse communities, and everyone know that we're going to be there for the long run, that we're invested in making our city, our state, our nation, all be able to understand the information and be healthy and well. That's what I fight for with health literacy, is making sure that everyone understands health information so that they can stay healthy and well rather than waiting until they're sick. So can I get coronavirus from a COVID-19 vaccine? No, the vaccines only contain man-made pieces copied from the virus, not the whole virus. So this is new, because usually when we develop vaccines, they're weakened or killed viruses. But with COVID-19, they're just using pieces of the virus. So it cannot cause COVID-19 in someone who takes the vaccine, sorry. Why is more than one vaccine needed? Well, I kind of explained that before, because we're going to possibly have different ones for different groups of people, and we want to make sure that they all work safely for different populations. The FDA, their Food and Drug Administration, makes the final decision about the release of a vaccine, and they will make a risk-benefit assessment, so decide if there's any risks of the vaccine and what the benefits are, and they won't approve a vaccine unless they know that it is safe and effective. So we know that the timeline for COVID-19 vaccines has been somewhat rushed, and does that make them less safe? Well, all the usual steps and procedures for vaccine development and FDA approval are being followed. They just are on a shortened timeline, and we'll talk a little bit about that in just a minute. And then also, if I've already had COVID-19 and recovered, do I need the vaccine when it's ready? Well, the truth is, and this is why we need to be transparent, is the CDC doesn't know if someone who had COVID-19 can get it again or not. Early evidence suggests that natural immunity may not last very long. So yes, it would be necessary, if that's the case, to get vaccinated, and we'll talk more about that as well. So what are scientists doing? Well, I'm involved in the Community Engagement Alliance Against COVID-19 Disparities to work to help prevent and treat through these clinical trials and development of these vaccines. And we'll look a little bit more at their website, because it has a lot of great information that you can link over to. It's very complex information. So it's, if you want more in-depth information, I've taken that information and simplified it today to make sure that you can help your communities understand by bringing in this more simplified information. So as I mentioned, if we're going to be talking about vaccines, what are they? So it contains the same germs that cause the disease, but for example, measles contain the measles virus, flu contains the flu bacteria, but they have been either killed or weakened, like I mentioned. But COVID-19 vaccines are different and contain only a man-made piece of the disease. So what does a vaccine do? Well, it stimulates your immune system to produce antibodies, and we'll talk more about what antibodies are, but they help fight the disease. They recognize it when it gets into your system, and they go out and prevent you from getting sick. So vaccines have been used for a long time around the world and have eradicated many diseases, and or reduce the burden of some as well. So we know that that's how we are going to be able to fight COVID-19. And we've talked a little bit about how they can't give you COVID-19. So looking at a pictorial graphic of how vaccines work, basically your body recognizes the COVID-19 virus. It sounds an alarm that sends your fighter cells and proteins into action to build antibodies that then fight that COVID-19 virus to prevent you from getting sick from it. So as I mentioned, antibodies provide a way to stop COVID-19, and they recognize and bind to the surface of the virus, which blocks entry into your cells and prevents infection or disease. They can be produced in different ways. We talked about getting a vaccine to produce them. They're also naturally produced by your immune system if you've had COVID-19, but I also mentioned that we don't know at this point how long they stay in your system. And they can also be created in a laboratory by scientists, but may only last a few months. So here's a video by the World Health Organization that you might want to go to on your leisure time to watch more in depth about vaccines. How are antibodies different from vaccines, however, is what we want to talk about right now. So when we can also, like I mentioned, give antibodies straight into the body that are made in a laboratory. And these studies skip the step that have you make them yourselves, either by getting sick or getting the vaccine. And it's done with either a shot or through your veins using an IV. And they produce, the ones produced naturally by your body or a vaccine can last a longer amount of time, but the laboratory made antibodies usually only last for a few months. People may require many doses on a regular schedule, and therefore a vaccine remains the best long-term solution. So I just made a little chart that kind of compares the two, vaccine antibodies versus man-made antibodies, and just seeing that, you know, it would be better if we can find the vaccine in order to provide that long-term immunity and not have to have many doses on a regular schedule. So monoclonal antibodies are the name for these man-made antibodies, and this graphic can show you kind of what that means, but basically they work the same way, but they just don't last as long. And why are we using them then if that's the case? Well, because they can serve as prevention until a vaccine is actually ready, and may provide fast protection or treatment for people exposed but not vaccinated and not yet sick. And they may help people who cannot develop or maintain a good immune response after a vaccine, such as older adults. There are some potential side effects, so we need to be transparent about that when we're out speaking in our communities. Flu-like symptoms, nausea, vomiting, diarrhea, or low blood pressure. So it would be important to make sure that if you were going to recommend that to someone, or you know, just educating them about their options, that you make sure and let them know that. So as I mentioned, the CoVPN website has a lot of information that is much more detailed than what I'm talking about today. But as this training becomes available, and it will be available in both Spanish and English, and the link will be shared so you can go through the whole thing, which takes about 2.5 hours. That's why I'm talking so fast. But you can link out to those sites. And then there's also an explanation on this website of NIH that talks about what the Community Engagement Alliance Against COVID-19 Disparities is and does. But basically trying to make sure that people in disparate communities are healthy and well and getting what they need to battle this pandemic. So true or false, if you don't mind answering in the Q&A, a person's immune system makes antibodies after getting a vaccine. James is going to help me out by letting me know what you guys are answering.
I'm getting a lot of truths.
All right, well, let's check it out. That is correct. COVID-19 vaccines expose you to a live virus and may infect you. True or false?
It looks like the consensus is clearly false.
Okay. And that is absolutely correct. Great job. So I see everyone is awake and paying attention. So why is this all important? Well, disease spread occurs when some proportion of the population can get the disease. So what we're trying to do, and I know that this has been tossed around in the media, but we're trying to form what we call herd immunity, because we want to get a proportion of the population to become immune to this disease, so that decreases the risk of spread from person to person. So I pulled this graphic from the Journal of the American Medical Association that shows you, if you can see this, that herd immunity can help control the spread. So this red person here is a disease carrier. The blue people are susceptible, and the purple people are vaccinated or immune. So you see here, when we don't have herd immunity, everyone is susceptible to these disease carriers. So that means that our whole population could get COVID-19 at once. Why is that bad? It's going to overwhelm our medical system, and we aren't going to be able to take care of those who get the most severe form. So then our deaths and long-term disability of those people are going to increase. That's not what we want. So with herd immunity, these purple people help block these disease carriers from the susceptible people so that it reduces transmission of the disease. And that is what we want, because we don't want our medical system getting overwhelmed. So the protection offered by vaccines may wane over time, which might require a repeat vaccination. So we need to be transparent with our communities about that. But we do know that we depend on enough people being infected by the disease and recovering or getting vaccine to keep this herd immunity going. And even if a large proportion of adults have developed immunity after prior infection, it still may circulate among young children because their immune system may not be strong enough yet. We need to be transparent about that. As we've talked about that with COVID-19 infection, we don't know how long the immunity will last, but overall, we do know that herd immunity reduces the risk of the population getting the disease. So as we mentioned, we have to get enough people vaccinated or enough people that have had the disease. So in the meantime, why are we doing all of these preventative measures, wearing a face covering, social distancing, washing hands, cleaning surfaces, and limiting large groups? Well, that's because we've got to wait for these vaccines to be ready. And in the meantime, we want to not have so many people getting COVID-19 that it overwhelms our medical system and leaves people without care. So true or false? And I think I forgot to mention this. So it requires a different percentage of the population to reach herd immunity. For example, a disease that's very contagious, such as the measles, requires more than 95% of the population to be immune. However, that's not true for all diseases. So not every disease requires 95%, and they are still debating on what the percentage is going to be for COVID-19. I think the last I heard is that we're hopeful we can get to 50%, but it may take even 75%. So then, true or false, for any disease, 95% of the population must be immune to achieve herd immunity. True or false?
It looks like I'm getting a lot of false.
That would be correct. Right, so we don't necessarily have to get to 95%. We just want to get a good high percentage. Herd immunity can happen through infection and recovery or by vaccination. True or false?
The trues came in very fast.
Okay. Good job, everyone. All right. So what are clinical trials? Well, a clinical trial uses volunteers to test new medical treatments. And we know that this is important because we've got to make sure that they're safe and effective, or else we would be giving people vaccines that we know nothing about. So we ask for people to volunteer, and we know that modern medical advances have helped millions of people live longer, healthier lives. And without medical research, we wouldn't be able to achieve that. But what clinical trials do is they compare a new medical approach to a standard one. They may compare a new medicine to one that has no active ingredients, compare a new intervention to no intervention. They do a lot of different things, but in the overall big picture, what we're trying to do is find out if a treatment works. Does it work better than other treatments or no treatment? Does it have side effects? And is it safe? And that's why we use clinical trials, is each phase of the trial answers some of these questions that we have to know in order to move forward with approving a vaccine. So the first phase is kind of what we call a pilot study, but it's just a few healthy volunteers that see if there's any side effect. And then you move to phase 2, which would be more volunteers, and you see if, if different people with different genetics have it, is that going to make a difference? So evaluating the safety of that effect. The third phase is they confirm the safety of the effect, and then the fourth phase happens after it's released, and we're testing subpopulations of volunteers, or after it's approved, and we're testing subpopulations. So I mentioned earlier that, you know, the COVID trials have been a little bit on fast track, and what's happening is they're just, instead of waiting for phase 1 and phase 2 to be over with, they're going ahead and starting phase 3 and having these different phases happening alongside each other so that we can get to approval faster. But they're still doing all the phases and for the time period required, or looking at the things that are required. So here is a video from HHS that talks about whether or not to decide to participate in clinical trials. And again, if you want to know more details, you can go to the CoVPN, and they have the current clinical trials listed. So you can actually go through there and say, oh, I think I fit the criteria. I might want to volunteer. Again, it's pretty complex. So if you are working with someone in the community, you might want to go through that and help explain to them. But what you'll be doing is there's different, you know, phases that the clinical trials go through, not just the phase 1, 2, and 3, but also, you know, in terms of approved protocols, and protocols are what researchers use to conduct clinical trials. And we want to make sure that everyone understands, so where they're getting into the process and what's going to happen. So that's where community workers that, you know, our health workers can help to assist, is bridging that education and communication out in the community. So why is there urgency to recruit people for the COVID-19 vaccine trials? Because we know they continue to increase. And I happen to put the rates for Texas, but also nationally into the training. They both are data dashboards, so they update every day if you click on the links. But we do know that disparities continue in Black, African American, Hispanic, Latinx, and Native American communities. Who are we trying to educate about COVID-19 trials? Everyone. And which groups are lacking in the COVID-19 trials? Members of minority groups and people disproportionately affected by COVID-19. So if you click on these in the training, they just go to the statistics about the cases of COVID-19. There's lots of resources, and you will actually be able to, we'll be sending out a list of resources at the end of the training. So you'll be able to access many of those. So how do we protect people in clinical trials? Well, we protect them through what we call informed consent, and you might have heard that term before, but basically what informed consent does is it helps protect people by making sure that they understand risks, benefits, and other options to the study that they might be participating in. So by going through what we call informed consent, we make sure that they understand, because we know in the past, people might not really understand, and that's what I do with health literacy is, you know, make sure people don't sign something that they don't truly understand. So break down the language into a simplified form so that we know that they do. Here is another HHS video that you're welcome to view at your leisure. But what we do know is that informed consent requires that a patient have full understanding of that to which he or she has consented. And authorization from a patient who does not understand what they are consenting to is not informed consent. So we also have at our research institutions what we call, and I think at medical centers as well, institutional review boards, where they review, approve, and monitor these clinical trials. So that means that an independent researcher or doctor or whomever cannot go and do research without having it cleared through these IRBs. And that helps to protect consumers as well, because they have a set of standards that they look at your protocol and make sure that you are keeping people safe, that you're not leaking their personal information. There's a lot of safety measures in IRBs and informed consents. So I'm not going to go through this in depth, but in Tarrant County, which is the county in which I live and am working on Texas SEAL, we have developed a plan to make sure that everyone stays safe, that everyone is respected, that we understand people's beliefs, and we work with their trusted leadership, incorporating culture and making sure that we're relevant to them in talking about COVID-19 clinical trials and vaccines, so that we're not misleading people and that they know that we are in this for the long haul and that we care about their health and wellness. So who can participate? Well, it's different for every protocol. So it just depends. That's why I say, you know, if you go to sign up, you can look at that whole page and see if you match the criteria, if you want to volunteer. But it's going to differ by the reason they're conducting the study, who they're looking for. Some of the COVID-19 studies want people who are healthy and well. Some want people who have pre-existing conditions. So you just have to kind of sift through that, how many participants they need, all of the different things that are going to happen with those participants, tests, procedures, shots, any of that, how long the study will last, the information obtained about participants. And every trial, as I mentioned, is different, and different people may qualify for different trials. And we depend, as I mentioned, on medical research for these breakthroughs that at some point will allow us to resume a somewhat normal life, hopefully. And they all have rules, these eligibility criteria that I just talked about who can participate, and you would be able to find out about those rules as you look at them. So on the CoVPN website, there's also a way that you can direct people to actually sign up to volunteer. And what they would do at this point is take a screening that would find out, you know, if they're able to participate in any of the ongoing studies. And then they would just click here on volunteer now and be able to sign up. One thing to note, or there's several things to note, is that volunteers will continue to use their own usual health care. So they'll need to make sure that their primary care provider knows that they are volunteering. Each study has benefits and risks. We've talked about that. So, but those are weighed by the IRB, so that it protects people. But also people need to be informed about what those benefits and risks are. So informed consent. And then any additional procedures outside of the normal we'd want to make sure that they know, you know, what else might happen during that particular trial that might be different than another trial, so that they know what they're consenting to, how long and where the studies will take place. And that should be disclosed in the protocol of the study. And then most studies give incentives, pay or gift cards. These are not to coerce, which means bribe or talk them into people to participate, but really to compensate them for their time and effort. So we would never want someone to join a clinical trial without their full consent and full understanding. So if someone's thinking of participating, again, there are many resources on the COVID-19 Prevention Network that I've shown you that can link over. There is also a page on what to expect if you do volunteer. Interestingly, Pfizer had this little graph on their website that 96% of people who participated in a clinical trial would be willing to do it again. And 9 out of 10 participants would recommend a clinical trial to their friends or family members. So I think that we've learned how to make them a positive experience, make sure people are well informed, because the last thing we want to do is have somebody find out after they've already signed up that there's something in the study that they weren't anticipating. And we have made them feel safe and like they're helping their communities. And that's really what we want people to do, is be able to help others that need these vaccines to stay healthy and well. And so they'll go through the initial screening, informed consent, and then they'll go through a more detailed screening exam, which will include medical history and a physical exam as well. So just so long as they know all of this is coming, so it's not a surprise. This links again back to the screening registry, which is where, if you want to volunteer, it says volunteer now, and you can click on that and sign up on the CoVPN website. If any of you have questions about that, I'm happy to answer how you can get to that website or link over. We can share that information. I actually am involved in seal.texas, so if you happen to sign up as a result of this webinar, I would appreciate if you use that code when you sign up. And no pressure. We never want to push or guilt someone into participating in a trial. So as you're out in your communities, make sure that they only volunteer if they are completely comfortable with their decision, or that you are comfortable if you decide to volunteer. There are no such things as incurable. There are only things for which man has not found a cure. So if you decide to sign up, be sure you ask a lot of questions. Again, we want to make sure people understand everything that's happening. So these are just some suggested questions that you might want to ask. What is being studied? Who will oversee my medical care? We know now that that's your primary care provider. Yes, you need to tell them. But these are questions that you can make sure your community asks as well. Why do researchers think this intervention might be effective? So all of this will be given as each vaccine comes out. And we know they will have been tested, because we know now what clinical trials are, and that they wouldn't be approved by the FDA if they hadn't been. And then, for each study, again, different interventions are going to be different, but just making sure that all of these questions are answered so that people feel comfortable going into clinical trials and know what they're going to be getting into, any follow-up care that's included, any pay or compensation, or payback for any other expenses that might be occurred during that participation in the clinical trial. So again, here's another HHS video about questions to ask before volunteering, basically going over those same questions that I just provided to you. True or false? So participation in clinical research is voluntary. Is that true or false?
Well, it looks like overwhelmingly true.
Okay. All right, perfect. If you agree to participate in a research study, I don't know that I answered this, so we may all learn it together. You may not leave the study for any reason.
It looks like false is the majority.
Okay, and that is false is the correct answer. So one thing I didn't teach you, but I'll be teaching you now, as part of informed consent does tell you that if you decide that you want to opt out at any time, you want to quit the study, you no longer want to be involved, you are welcome to leave at any time. Clinical trial participants should volunteer only if completely comfortable with the decision. True or false?
True.
All right. Great job, everyone. More resources. Again, many of these links will be sent out to you. I've talked a lot about why we need your help with this, so I hope that you understand, is that basically we need you to be out there explaining these COVID-19 trials, vaccines, the reasons for the behaviors in terms of masking and social distancing, all of this to your communities to help keep them safe, because they've been most impacted. And whether it's a health literacy issue, which health literacy actually is a social determinant of health, or a social determinant issue, again, we just want people to be safe. We want them to know the things they need to know. Right now with the SEAL program that I'm involved with, we are working on these different handouts that will be made available for you to take out in your communities with you. So that that is available kind of, you know, as a hard thing that you can give away while you're out in the community. The last thing I want to talk about is personal protection. So if you are going out physically in the community and not communicating with them electronically, it's really important for you to keep yourself safe as well. So we know that that's why we're masking and washing hands and all these things. But if you know that you are going out into a community and might come into contact with several different people, or be there more than 15 minutes, or be closer than 6 feet away, then you would want to make sure you have PPE. So you need to know when it's necessary, what kind is necessary, how to properly put it on and take it off, because that is important as well. What limitations there are to any particular equipment you may be using, proper care, maintenance, and its useful life and disposal. So again, you know, crowded situations, close physical contact, enclosed spaces, and longer than 15 minutes are the things you need to remember. So keeping distance, meeting on front porches or in the yard, being prepared upon arrival to limit the time you spend, and using PPE. So there's some handouts on CDC about how to use your PPE, and these are some infographics that I believe you will be getting a link to. But putting it on in specific ways with clean hands and hand sanitizer, and the method and the order in which you put it on is very important. So just making sure that you follow those steps. There's videos also on the CDC about how to put on, or donning your PPE, and how to take it off, or doffing as they call it. But removing your gloves, removing your gown, performing hand hygiene, and then you remove your face shield or goggles, and then removing or discarding your face mask. Do not touch the front of your face mask when you're taking it off. You unhook it from behind the ears and pull it away from your face without touching the front. And then perform hand hygiene after you remove the face mask. So again, another video available on CDC. And a couple more true or false. Health literacy is a person's skill or lack of skill. So do we blame people for not understanding health information, or do we help them understand information? So is it a person's problem, true, or is it not a person's problem?
Looks like the majority is false.
That is correct. We need to help them understand. And oh, I must have set that up wrong. I will fix that. Proper hand hygiene includes using an alcohol-based hand sanitizer or washing your hands for at least 20 seconds.
True.
That is true. Correct. When removing a face mask, you should not touch the front of the mask.
True again.
That is true. All right. So more resources. There's a graphic here that you can, that will be sent along with all the other resources. There's an exam to this module in Texas. Our community health workers get continuing education, so they have to take the exam to do that. There's also a downloadable list of resources. Again, I want to thank you for joining us today on this webinar, and here's the downloadable resources. Just a reminder of the National Institute for Minority Health and Health Disparities. And the Texas Center for Health Disparities have funded this module that I've developed with my colleagues. And I also do research in maternal mortality in the Texas Center for Health Disparities, which I think some of my resources will actually be shared with you in the not too distant future, including the app I developed called What About Mom? So you can look forward to hearing more about that. And with that, James, I think I'm gonna turn it back over to you.
Well, thank you, Dr. Wagner. I know I learned a lot, and judging by the interaction in the chat and the Q&A, it looks like a lot of people have a lot of questions, and we just have a few minutes. So I've tried to select and combine some of the most popular questions.
Okay.
First, we got a lot of questions about how can people access the website presentation that you were using today, and do other states outside of Texas have similar certifications, and how can people access that?
So this training will be available in both English and Spanish on a website that will be, the link will be sent out. I don't know how quickly that turnaround is going to happen, but soon. And so yes, other states do not have this particular training. I think I kind of was ahead of the curve on developing it. But again, I am happy to share it with everyone in every state.
That's great. Thank you for that information. We got several questions about how, as community health workers, do we communicate to people who still really feel like COVID-19 is just the same as the flu? Do you have any strategies for reaching those people?
Right. So the difference between the flu and COVID-19 in terms of medical demand, right? So people may get the flu, but it's not possibly as contagious or severe. So it's not necessarily overwhelming our medical system, whereas COVID-19 has the potential to do that. So that's why early on, I haven't heard this term as much in recent months, but early on they talked about flattening the curve. And that speaks to this whole point, is that with COVID-19, you know, that curve is going to be like high and peak, and medical capacity, you know, may be at this line, and here's the peak. So we surpass that. So that could cause a lot of deaths and a lot of long-term complications. Whereas the flu tends to happen with more of a subtle curve. And that's why the flu doesn't have the impact that COVID-19 does.
That's great. Thank you for that information. We also got several questions. I know you talked about diversity in trials and how to join a clinical trial in your area. Can you talk about why it's so important to have a diverse population in a clinical trial?
Okay. So as I mentioned, right now, most of the people who have been volunteering for clinical trials have been white. The problem with that is we know that with different races and ethnicities, we have different genetic makeups, right? We also live in different circumstances. I talked about the social determinants of health. So if we only have white people that are volunteering for clinical trials and we never get to work on a vaccine that fits other genetic makeups and other circumstances, then these vaccines that are produced may not be safe and they may not be effective. So they could actually harm other populations and they could actually not work. And so that population would still continue to have a high disparate occurrence of COVID-19.
Yes, and thank you for clarifying that and why it is so important that we reach out into our communities and talk with people about this so that people can volunteer to join a clinical trial if they choose to do so.
Exactly.
And as we're getting, people into clinical trials and they're happening, and I talked about the announcement of Pfizer and Moderna at the top of the webinar, and I talked about how they were rated to be effective. How do we actually know that the vaccines are effective?
So as we mentioned, they've gone through clinical trials and they've gone through the different phases of the trials, and each phase tests not only safety, but what we call efficacy, which is basically effective. And that I mentioned as well that the FDA would not approve a vaccine unless it passes those clinical trials. So that's how we know that it is safe and effective.
Yeah, that's great. Thank you so much for everything that you've shared with us today and for answering these clarifying questions. Questions are continuing to pour in, and I could just keep going, but we are nearing the top of the hour, and I want to be very respectful to all of your time today. So just a few housekeeping items before we go today. I'm going to share my screen once again. Thank you so much for everyone for taking time out of your day and joining us. If you have questions about something you saw or you want more information about something, please feel free to reach out to us at partnerships, that's partnerships with an S, at hhs.gov. We will be happy to respond to you. Please note, we will be sending a link to the recording of this webinar. It will take a couple of days for that to be ready, but that will go out automatically to you if you registered for the webinar. And I just wanted to mention there were several questions about CEUs. We are not able to offer official CEUs for this webinar, but we will be sending out a participation certificate in the follow-up email. And if you registered for the webinar, you will automatically receive that. Again, thank you, Dr. Wagner, and a sincere thanks to everyone for your participation today, for your questions, for your thoughtfulness. My name is James, and I'm here at the HHS Center for Faith and Opportunity Initiatives. I have the privilege of working on our maternal health issues. I also get to support the team in our COVID-19 work and many other areas. We would love to hear from you, so if you have more questions, please feel free to reach out to us at partnerships@hhs.gov. Thank you so much for joining us today. Have a great afternoon.